More than 100 million Americans live with chronic pain every day. Fortunately, effective pain management can help those suffering from pain to have better, more productive lives. Like Kim Wommack of Troy, Missouri. She has experienced chronic neck pain for several years.
I was feeling pain in my neck back here when I would turn it or hold it in a certain position for a while, like when I did my computer or bookwork or whatever. Then at night when I laid on my pillow, that little bit of elevation, I guess, would make it real uncomfortable to sleep. It pretty much hurt all the time. It was really bad. I couldn't turn my neck certain ways. I couldn't hold it one way for a long time. The pain would shoot up my head and I would have headaches. It was bad. Before I met Dr. Gheith, I tried massage therapy. That worked. I mean, it felt better while she was massaging me, but didn't do much afterwards. I went to a chiropractor, and when he would try to crack my neck, that pretty much made it worse. Went back to my primary care doctor. She gave me muscle relaxers, but since the pain wasn't muscle related, those didn't help at all. So that's when she referred me to Dr. Gheith.
Dr. Ramis Gheith is a pain management specialist with SSM Pain Care at St. Joseph Hospital West in Lake St. Louis.
She came to us initially with the primary complaint of severe neck pain with the inability to turn her neck without experiencing this pain. The pain was limiting her range of motion, and it was making it difficult for her to do her daily activities that we take for granted, such as shopping or maybe even driving her car.
Dr. Gheith said I had 2 bulging discs in my upper spine, and the material in between the discs was wearing thin.
Multiple therapies have been devised to help people treat their back pain, neck pain, or mid-back pain. Radiofrequency neurotomy, otherwise known as radiofrequency denervation or radiofrequency ablation, is a procedure that is devised or designed to treat the patient's chronic, intractable pain, which has been persistent for several months or longer.
Radiofrequency neurotomy uses a needle to precisely target and deliver high-frequency radio waves that heat and destroy a small section of nerves. This prevents pain impulses from being sent to the brain.
Prior to undergoing radiofrequency neurotomy, patients typically fail a host of conservative treatments. Those conservative treatments extend from physical therapy to a regular home exercise program and oral analgesics. If the patient presents with continued intractable and persistent pain despite undergoing multiple conservative therapies, then we may choose to proceed with a radiofrequency neurotomy if they meet all of the preconditions. Depending on the patient's primary complaint, we would approach the patient with what we call diagnostic injections first. And these diagnostic injections are meant to determine whether or not if the patient's a candidate for radiofrequency neurotomy or denervation.
For a diagnostic injection, an anesthetic is administered to the area that is causing pain. If the pain intensity decreases, doctors can be confident that radiofrequency neurotomy will be successful.
We had to do it 2 times on each side with lidocaine to make sure it would work. Lidocaine would help make the pain go away for a day or so. And then after we found out that that was for sure going to work, then we did the final treatment.
After the diagnostic procedure indicates that a patient is a candidate for treatment, nerve stimulation is used to determine which nerves are to be targeted.
The stimulation occurs in 2 forms. There's a sensory stimulation and a motor stimulation. The sensory stimulation is done to identify the very specific nerve at the level that we're targeting. We follow that with a motor stimulation, and that will identify the muscles that are involved with that very specific nerve as well. Once we're accurately placed and identify the areas of stimulation appropriately, we then proceed with the radiofrequency ablation of that region. Once we did the radiofrequency neurotomy, the patient reported to us that she had a significant improvement in her function as well as in her pain control. She was able to go back to driving without pain and doing her normal activities of daily living without pain, as well as she reported less headaches, less neck pain, and less upper back pain as well.
After the procedure, over about a course of 2 days, the pain was completely gone.
This procedure can be a permanent procedure in some cases. However, in most cases, it is a temporary procedure that lasts approximately 1 year. In some patients, they will return prior to that 1-year period, secondary to their pain recurring because the nerves do grow back in this area of the nervous system, and as they do regenerate, the patient may re-experience the pain at some point in time in the future. In that instance, the patients may be chosen once again for a repeat radiofrequency neurotomy after an appropriate physical examination, which demonstrates the same.
I got my mobility back. I can turn every way, whatever, down, and it doesn't hurt. A lot of the headaches went away. That's a big plus.
Mrs. Wommack is a great example of that response that we see on a regular basis in our patients. Most patients who undergo this procedure have a complete resolution of their pain or a very significant resolution of their pain to the point where they obtain their function back and obtain their normal activity of daily living back and go back to a better quality of life.
I just want to tell Dr. Gheith and the staff that I appreciate everything they've done for me. They made my pain go away, and now I can do everything that I want to do.
For more information or for a referral to an SSM Pain Care specialist near you, call 1-866-SSM-DOCS.